I can hear and see fine, Max.
Oh, thanks very much, Lisa Marie. So a very warm welcome to everyone this morning for this meeting of Renfrewshire's Integration Joint Board. So a very warm welcome to those of you online, because we have a number online, those of you in the room in Paisley, and of course members of the public as well. For those online who might not be able to see, we have a really good attendance today of members of the public, so welcome to everyone. As I've been speaking, the recording of this meeting has started, so this is a recorded meeting that is available online afterwards. Just as a reminder, particularly given we have such a good attendance today, while it is a public board meeting and members of the public are very welcome, it's good to see so many people. When we get into debate and discussion, I can only take questions and comments from members of the IGB rather than those in attendance today. With that, can I just confirm, name, do we have any apologies today?
Yes, apologies have been sent by Alan McNiven this morning.
So no Alan's apologies. And then can I check, are there any declarations of interest or any transparency statements that need to be made on today's matters? I don't see any hands and shakes of heads around the room, so we'll note that as there are none. So before I go on, I'd like just to take a moment within the meeting on behalf of everyone in the IGB to pay tribute to Helen MacLear, who sadly passed away since our last public meeting of the IGB. It is absolutely clear from the many messages shared at the time that Helen's passing has been felt very deeply by everyone who knew her. As the first carers representative on this IGB, Helen was a dedicated and compassionate advocate for unpaid carers, and particularly for people with learning disabilities. She brought a strong voice, clear purpose, and a collaborative spirit, helping ensure carers' perspectives were heard and placed at the heart of our scrutiny. Through her more recent work, which included her contribution to initiatives such as the Futures Options Group, Helen helped shape services and strengthen partnership working in a way that has made a real difference across Renfrewshire. So on behalf of the IGB and the Health and Social Care Partnership, I would like to express our sincere thanks for the commitment Helen showed and extend our deepest condolences to John, Amanda, and all of Helen's family and friends. Thank you. Yes, I think that's a good, yeah, absolutely. Thank you. So with that, I'll now start business on the formal agenda this morning. And the first item is the minute of our previous meeting, which was on the 27th of March. I don't turn the pages on minutes, they're in the papers, but I pause just to confirm if there are any matters to raise, factual inaccuracies or anything we have to record in those. I'll just pause, and if there are no hands, I'll take those as approved. So take those as approved. Thank you. Okay. The next item, and I think it's been a welcome addition to our agenda, that we're trying to bring alive some of the services that we provide here. So I'll hand to Francis for a quick introduction, and then we have a little video to share. Thank you.
Good morning. This video highlights a prevention programme which was funded by NHSGGC Public Health to reduce tobacco use, respond to increased vaping and limit second-hand smoke exposure for children and families. So in the video you're going to hear from Keely, who's our community-based health development officer, and her role is based at Engage Renfrewshire, where she delivers a joined-up, locally responsive approach, and she works alongside the health improvement team as strategic lead. So you'll hear about how this model strengthens prevention, builds workforce confidence and improves links to Quit Your Way support, targeting those most in need. Thanks.
So my name is Keely. I'm a Health Development Officer at Engage Renfrewshire. So my post is very much about preventing harm from tobacco, vaping and second-hand smoke throughout Renfrewshire. My post is very much centred within the community. It's based in Engage Renfrewshire, and I very much work with third sector organisations and see myself as a bit of a link between third sector as well as statutory services to make sure that I'm engaging with groups in the community who might not engage with more traditional health services. So in terms of what I actually deliver, I've been delivering vaping awareness sessions to staff and volunteers who work with young people, and that's really about increasing their confidence to confidently discuss vaping related harms with the young people that they support. We know that that's really important because that's what a lot of staff and volunteers have fed back to us, not just in Renfrewshire but throughout Scotland. They just feel that vaping is something that's so new to them that they're not sure how to confidently discuss that with young people, and it's really important to make sure that those young people are getting that consistent message. So that's been really effective so far. We've been able to deliver 10 of those sessions in the last year, and that's reached 101 staff and volunteers representing 13 different organisations throughout Renfrewshire. So that's quite a large number of young people who will ultimately be receiving that kind of consistent message. I've also been supporting the expansion of the Jenny and the Bear programme, which is a programme to raise awareness of second-hand smoke. And that's not only delivered in primary schools, but it's also been expanded into nurseries as well. So I've been able to get another 8 nurseries on board with delivering that programme in the last year. I've also been able to work with groups on a more one-to-one basis. So I've been working in groups where there are higher smoking rates than what we would see in the general population. And that's just really been about being there, making sure staff kind of know how to have those conversations with people who smoke and they're not shying away from that, making sure they know where those people should go to access support should they want it, and just making sure they understand the kind of wider impact that smoking can have on health inequalities as well. I'm able to deliver most recently a session to primary 6 pupils as part of the Safe Kids Renfrewshire programme. So that made sure that those children were able to receive information on vaping harms, not only for their health but for the environment as well. And that's at a really crucial age where we're getting in summer holidays, but we're also kind of preparing them for high school where they're more likely to be exposed to vaping. So we're making sure that they're getting that prevention message from an earlier age. The other thing is we want to make sure that we're kind of looking at other ways that we can try and reach young people. So one of the things that we've decided to do in Renfrewshire is to fund an organisation to develop a young person-led environmental project, and that's really about preventing young people from taking up vaping through the motivation of protecting the environment. We're also going to be supporting the development of a peer-led prevention model within Renfrewshire, so that will be working with young people to prevent them from uptaking vaping in the first place, and also supporting, providing that peer support to those younger people who are already vaping as well, and we know that that can be quite an effective model. I think overall I really see this role as having a real legacy to it in terms of making sure that it's sustainable. So a really key part of all this, and again the prioritisation for next year, is to make sure that staff feel that they've got the confidence and the capabilities to be able to deliver work related to tobacco and vaping related harms. And that just ensures that even beyond the life of my post, that this work is much more embedded within services, and hopefully we will end up seeing a reduction in the harms associated with tobacco and vaping.
Thanks very much, Francis, for introducing it, and John for helping pull the videos together. That's really helpful to see the work that's been done on the ground. That takes us to apologies, Ian. Yes, of course.
Oh, it's good to see that we're actually on the ball with this issue. You know, when you go about your business, you see loads and loads of people vaping. Big question for me is the availability of these things, because no matter what kind of shop you seem to go into nowadays, there's a big section devoted to vape. So there's obviously a lot of money in it for shop owners, and I think it's, you know, it's very tempting for kids because of the way they jump out at them, the different colours, the different flavours. It always despair. It sends me into despair when I see adults doing it as well, because quite frankly, adults who should know better. But children need to be educated on this, and I don't live too far along the road from Johnson High School, and you see them regular, as young as 12 and 13, going out for a puff, and it really saddens me, knowing that the impact of smoke and the chemicals that are in them have on in later life. So I'm glad we're on it. And we're glad we're educating people, because there's a lot of myths about these things. So if we can get people educated and know exactly what they're actually doing, I'm all for it. So well done, because sometimes we can lag behind in these issues, but we're not just the Health and Social Care Partnership, but the council. To be fair, it's regularly spoken about at council meetings as well, and I know officers are on the case. Thank you.
Thanks, Ian. I think everyone's in agreement with that. I probably don't want to then open up into a discussion about a wider public health around it, but I think I get nods. I sense everyone could continue this discussion. In the interest of today's agenda and the business today, I think we'll note that is something that we probably want to get more focus on, public health agenda wider, if that's acceptable to everyone. Thank you. Thanks, Ian. That takes us to item 3. Neil, I'm going to hand to you on the membership update.
Thank you. Yes, this report is just asking the IGB to note the appointment of Amy Fraser as a proxy for Linda Gregg, the service user representative. And secondly, that Councillor Fiona Airlie-Nicholson has been appointed as a substitute voting member to the IGB on behalf of the council. This is just for noting at this point. Both of these positions are statutory positions, if you like, so no approval required, just for noting. Thank you.
Thanks, Neil. That's helpful. Just keeps everyone up to date with membership details. Thank you. That moves us to item 4 of the agenda, and it's the Chief Officer's report. So, Billy, I'll hand to you.
Okay, thanks, Chair. And in the interest of time, recognising there's a very busy agenda, I'll take the paper as read. It's there for noting, but happy to take any questions. Thanks.
It's worth saying that this will come up a few times today. I have spent a wee bit of time with the team just saying that a lot of the details are in the reports, and I know all the members do spend time reading them. So rather than asking them to reread them to us in public, it opens up and frees a bit more time for debate and discussion. So hopefully that makes sense to everyone. So with that, I'll open up if there are any questions, accepting obviously digital hands and physical hands in the room for anyone that Willie, do you want to come in?
Yes.
Yes, bring you in.
Yes, sorry, I just lost my place there. As you'll probably be aware, I have several questions throughout this meeting altogether today. So, if time is of an essence to you, unfortunately, the questions that I have from carers will need to be answered. With regarding item 4 for the Chief Officer's report, I have a question relating to point 12.2. And basically the question is, how can we keep going down the community-based support activity when the Health and Social Care Partnership are closing community services, as in item 8 of today's agenda? So can you now confirm that we are now going down the route of unpaid carers to cover all unfunded services and losses?
Okay, thanks for your question, Willie. I think the question in terms of the ability for us to shift services in the way that we aspire to, around shifting towards prevention, early intervention, is really challenging given the current financial climate, but it's also essential. If the demographics mean that over the next 20 years, that will only get tougher, demand will rise, and resources are likely to become tighter. So we need to make those shifts. With regard to your question about unpaid carers, absolutely key partners along with the rest of our communities. So what we're looking to do is strengthen those links with communities, with unpaid carers to see how we can support each other through what is going to be a shift in the way that we deliver health and care over the coming years.
Jacqueline, come to you next.
Thanks, Chair. Yeah, I just wanted to speak in support of item 12, the COSLA White Paper, a social care system built on prevention. No questions, just to really say I think that this is absolutely crucial for the way that we're going to be working going ahead. And, you know, clearly, you know, funding by the year is not working for us. Multi-year funding is crucial as well so that we can plan ahead. And I think that this particular part of the report is just the way forward for the future. So thank you.
Thanks, Jacqueline. I think a number of things in this report, Billy, also featured in the communications that go out to all members of the partnership. So we do see a lot of these updates regularly. Kath Coonage.
Thanks, Chair, and thanks, Billy, for your report. I just wanted to say it was really good to hear of the inclusion of Renfrewshire Health and Social Care Partnership in the Health Improvement Scotland Frailty Programme. I think that's an excellent step forward, and I know you have experience of that you bring with you from the Ayrshires. I just wanted to draw our attention to item 10 and the inclusion of Audit Scotland report. And I think it's really pertinent to today's discussions and the need to have this nested within a transformation approach. And I know we're going to come to that on the agenda, but I thought it was very helpful to have that in this early part of the meeting. So no questions, just both those comments. Thank you.
Thank you. And this report, Billy, is just for noting today, just a general updates. There are no particular items. Willie, do you have another question?
Well, it's a continuation rather than another question, and it's just basically to lay the foundation here. Obviously, I'm here solely as the carers representative, so anything I'm asking is on behalf of the carers and unpaid carers. This document as a whole, looking at it holistically, and particularly even taking it from the item 8, the sustainable futures. Every time when you talk of, yes, item 4, what I'm saying here is item 4, just at the start, we're talking here, this is going to be a hit, another hit for unpaid carers to carry the burden. Throughout this whole document, there's hit after hit after hit after hit on every item that we're going through here. This is not a Rocky film. How many times do you punch the unpaid carers and expect them to get up and do the same job with less and less resources? What I'm saying here is I'm laying the foundation down that this is hit number 1, just at the start of agenda on unpaid carers, to carry the burden which they're already carrying from previous decisions and cuts made by this IGB board.
Willie, I think your message is loud and clear. I think that's understood that that's the position of the carers representative. Thank you. I'm going to close item 4 and the Chief Officer's update. I don't see any other questions, so we are just noting that update. Thank you, Billy. That takes us to item 5 of the agenda, which is the in-year budget monitoring report. So Sarah, I'm going to hand to you for this one. Thank you.
Good morning, everyone. So similar to Billy with the Chief Officer report, I'm just going to assume that everyone has read the paper in front of them. There are a number of items to approve within the paper, and that's some key accounting adjustments that will help us to approve the unaudited annual accounts later, and that's in relation to general reserves and earmark reserves, which are detailed within the report, but more than happy to take questions.
And so Sarah, on this one, I guess what we've seen coming through is the pattern that has built up through the year. So I guess the year-end position is as has been reported and build up to this point. Yeah. So open up for questions. Come to Ian first. Thank you.
Thanks very much, Chair. So on page 25, and it says delegated services, and it says there's an underspend in housing adaptations. can you maybe explain to me what that means, underspend reflecting demand, and more importantly, the delays to project start dates? I'm certainly, in my role as a councillor, I'm finding more and more people are looking for adaptations. Well, maybe not so much looking, they need adaptations. And I think maybe in the last couple of months, I've been asking for more permission forms to speak to the staff at the Health and Social Care Partnership on behalf of my constituents than I ever have before. So the demand is certainly increasing. So I'm a wee bit concerned that there's possible delays to projects. Obviously, people need these adaptations now. They don't have to wait. Shouldn't have to wait for months and months and months. So if you can maybe tease out to me exactly what that line means, Sarah. Thank you.
And thanks, Ian. For that particular one, I don't have that detail. It sits within the council because it's the delegated budget that, although it sits within our reporting, it's part of the actual council process. So there are some delays to the projects, but I don't have that detail, but I can certainly get that for you.
Lisa, do you want to come in on that? I could see you looking up.
Hi, just from the OT's perspective. So currently people sit in the OT waiting list. It's quite a small waiting list in both localities just now, but they'll go out and they'll assess. So there's no change in the assessment process. We have introduced an occupational therapy screening panel with the head OT and the service managers, and any requests that come through for adaptations, they go through that panel just to ensure that eligibility is applied and it's fair and equitable across the board. So that's a new introduction this year. They then, once it's been assessed and it's appropriate, it goes to the council, and it's just the speed in which the contractors can work to. They get 2 quotes, they implement the work, and the council picks that up. So while it is shown an underspend, the actual amount of referrals, there's still referrals ongoing, we've just not paid them yet. So that underspend will, it carries on into next year. It's just the timing of the works and when payments actually due for that. But there's no change in our eligibility criteria for adaptations. They are going ahead. A lot of the conditions or the issues that we're finding just now is people may want an adaptation or need an adaptation in one part of their house, but actually that their current needs and our future needs means that the house is not suitable. So we wouldn't adapt one part of the house when the house is not suitable for their long-term needs. So what we'll do is we'll offer support of a letter and assistance for rehousing, to make applications and so forth, and that would go through the housing provider from there.
Thanks, Lisa, that was really helpful. Becky, I'll bring you in now.
Thank you, and thank you, Sarah, for the report. It's really comprehensive. And I think I've got my head around the reserves changing, but I think I asked last time what we thought our position would be in terms of reserves, and I was just looking back. I think we thought it would be about 1.5%, but am I right from the paper? Our dinners are probably about 1% now, which is obviously not where we want to be. Thank you.
Yes, that is correct. We are now below the threshold that we would ever want to be below, and that's actually reflected in a number of the reports that I've brought today.
Okay. Just checking. Becky, your hand's still, if that's fine. Don't see any other hands up in the room. So there's a few actions for us today in the finance paper. So I guess we're noting the update in the position for the year end. Apologies, I have to make this bigger so I can read. So we do have an overspend position that we're noting. We are then approving the increase to the general reserves, which is detailed in section 8.4.1. We're approving the drawdown from earmarked reserves, which is detailed at 8.5.2 to 8.5.4. And we're approving proposed transfers again in section 8.7 and 8.6 to earmarked reserves. And these details and transfers are in compliance with the requirements of how we have to, it's effectively transparency around the accounting of it, which is unusual for us to have to do in a public meeting, but it means you get that flow through to see exactly where everything ends up, in which bucket and how we can use. So there's a lot of detail in it, but it does provide all the information that helps us to position for the year ahead. Willie, I'd move to approve on that. Is it a question?
It's a question, yes.
Okay, can I just say, if there are questions, can we raise those before I move to approve, because that paper,
Yeah, I was just trying to find my place there. I apologise for that.
I'll accept it, but I'm seeking to approve this paper. Thank you.
It's just a question with regards to, you're talking about 5.4.
Let's start again.
Should have worn my kilt.
Start again, Willie.
Sorry, but my thoughts got right. Yeah. With regards to 5.4, you're saying in like say external care at home, the demographic changes and increase in complexity of care needed. So that reading through, there is an increase in demand here. However, we're saying at one part of the paper here, there's an increase in demand. Yet when we go to Appendix 9, page 597, we're then talking about cutting the service. So at one point of the paper, we're talking about there's an increase in demand, but yet we're going down the road of cutting these services. What road are the IGB taking?
The care at home. Yeah.
Thanks for your question, Willie. We're not talking about cutting those services. In fact, one of the things that we're aiming to do through our planned approach to redesign is protect those services. So Renfrewshire has one of the best performing care at home services in Scotland. That's why we have next to no delays. People are not finding themselves being delayed in hospital. We pride ourselves in that. We're looking to protect that. What that's demonstrating is that we are managing to deliver that level of performance through an overspend in that area. So we are continuing to overspend significantly in that area. So we do have proposals that will be coming forward around redesigning the service to try and support people to remain independent for longer, because that demand is likely to rise, and that is not a sustainable position.
We are approving the increase to general reserves, approving the drawdown from earmarked reserves, and approving the proposed transfer to earmarked reserves as noted at section 2 of the report. Thank you. That brings us to item 6 of the agenda. I'm still with you, Sarah, and it's the unaudited annual accounts. Thank you.
And again, I won't go through the accounts in detail because I don't think all of you are as excited about them as I get each year. So I won't challenge you to have read every page. But basically, they summarise the IJB's financial position for 25-26, and they are supported by a ream of financial statements and working documents that are passed through to the external auditors as part of their audit process. And they're designed to bring the story of how we've spent our money throughout the year to the public and all of our stakeholders. But what I would draw your attention to is included within the accounts is the annual governance statement, which is really key to it summarises all the controls and processes we have in place, summarises the risks, etc. of the IJB, and that's already been to the Audit, Risk and Scrutiny Committee and approved by them and internal audit. So today it's really just brought for yourselves to approve that they are then submitted for audit to Ernst & Young.
Thank you, Sarah. I mean, the process for these accounts is a really positive one in the sense that we have the opportunity to see them before they go through that external audit process. So it's a really helpful thing to be able to see at this stage before they're finally approved, which is later on in the autumn. So Ian, come to you first. Thank you.
Thanks again for producing this report. Item 3 is executive summary. It really just kind of sets the scene, you know, as we go into the next item. Rising demand, which we know about, increasing costs, which we hear about on a regular basis. But the key point for me is funding that is not keeping pace. And that's what really concerns me. There's not a lot we can do about rising demand, not a huge amount. We can't really do much about increasing costs. We all know the impact of various wars and other things that have been happening throughout the world have increased the costs dramatically. But funding is something that governments, both Scottish and UK governments, can do something about. And I think that's, you know, a huge factor why we're moving on to item 8. Don't want to get into, we'll be obviously discussing that in a couple of minutes, but I just want to highlight that. And I think it's been good that that's been highlighted, and it's an admission we are not getting enough money from our respective partners. Thank you.
Ian, I don't think you're looking for a response in
No,
that. No. Kath, come to you next.
Thanks, Chair. Thanks, Sarah. It's just a very small point. Excellent report. On page 67, there's reference to NHSGGC endowments funding. It's actually NHSGGC Care Charity, and if perhaps that could be updated going forward. Thank you.
Thanks, Kath. That's a really good spot. With items like that, do you make that amendment at this stage before it goes public, Sarah? Do it as part of the audit. So that's fine. That's super. And I guess that we have that opportunity through the period from now until the audit for, and that's not a substantive change. It's just the terminology has been updated. That's good. Good spot. Thank you. So with that, we are approving these accounts to be being public at this point. Sarah, is that correct? And then they are then available for external audit after that. Don't see any other hands or questions, so we're content to approve that item. Thank you. That takes us to item 7 of the agenda. I'm still with you, Sarah, and this is where we're considering the potential impacts of financial recovery. Financial recovery is something that we have talked about as a risk for us as a board for some time, and at the request of members, we had asked the management team to look in more detail as to what that might mean. So there has been a lot of work done in the background to try and establish what the implications are. So Sarah, thank you for this. I'll hand to you.
Okay, so for today, what we've done to try and simplify this, because it is a very complex process, we've done a very short animation, which will then be on the website so that members of the public can have a look at it whenever they want to as well. So over to John to play that, and then happy to take any questions.
Our local health and social care services are still facing significant financial challenges. Demand for support is rising faster than available funding. Our reserves have helped cover the gap so far, but they are expected to run out in the near future, and once they are gone, they are gone. Financial recovery is a real possibility. But what is financial recovery? The IGB cannot spend more than the budget has available in any financial year. So financial recovery would happen when there isn't enough money and reserves to pay for the services we currently provide. It would mean we would only be able to deliver the most essential services. Hiring would be restricted, spending would tighten, non-critical work could pause. Our services wouldn't stop, but less would be available. We would have to prioritise those with the most urgent needs, and may have to introduce waiting lists for services. Some people would not get the support they currently have. Families and unpaid carers may need to fill the gaps where they can. And this pressure could also shift elsewhere, including to hospitals and emergency care. Financial recovery comes with lots of uncertainty, but it would undoubtedly have a negative impact on people, families, and the wider system.
Thank you for that, Sarah. I think the paper that supports it is quite detailed, but I think that hopefully that animation provides a little bit of an overview and no means goes into the detail that's in the paper before you. So I'll open up for questions at this point. Jacqueline, come to you first.
Thanks, Chair. That was a really good animation. That's the first time that we've seen this as a board, but it was just perfectly encapsulates the paper. So thank you for that. Just as you said, Chair, the board did ask for this paper to be brought today because I think, particularly for members of the public, I think it was important that we're transparent about what we're facing in the future. And it's not just us as a Renfrewshire IGB, it's IGBs across all of Scotland, and it's a grim picture, and it's not a position that any of us particularly want to be in. But I think it's really, really important that we're clear and that we show what the consequences could be if we go down this route. So thank you for that, and thank you for all the work that's been done. I know there's been a lot of work done to bring this paper to us. Thanks.
Thanks, Jacqueline. I think I could see a few nods around the room. So I've got Ian, then Becky. Ian, come to you first.
Just to reiterate, I had skipped an item there. The last points I made related to this one. Having read 916 pages, I was getting very confused. Just to point out, my last comments related to item 7. Thank you.
That's fine. I think they applied to the previous item as well, in fairness. So your comments were not badly timed, Ian. Don't worry about that. Becky.
Thank you. I mean, I wanted to again to reiterate what others said about thank you for the paper. I think it's laid it out really clearly for us, and the animation as well. I like within the executive summary that we pull out the impacts, but I think I kind of wanted to add to the impact on the workforce, because although there's some things pulled out there, I've spoken to clinical colleagues in other parts where financial recovery has had to come in, and it's not just hard for them to deliver the care that they want, but also professional development to maintain that higher level of care, which we actually really advocate for in our clinical colleagues, is gone. and it's not, I mean, we talk about morale and burnout, which are very real impacts, but also just the ability to continue to stay at the level you want to be when you're delivering clinical practice is quite scary for me as well. So thank you.
Thank you. I think that is a good perspective around the impact on staff and how they would be impacted as well. Willie, come to you next.
Thank you, Chair. I think this part of the document, it spells it out quite clearly. Here you are in a situation that the IGB has a set amount of money. It's as plain as the nose and the end of your face. It's not enough. However, what you're doing is the cuts that you're making, again, are on the backs of the most vulnerable. The most vulnerable look at this entirely differently. We have, for example, there, we've had a wonderful result with Scotland beating Haiti the other night and everybody getting the day off. The Renfrewshire Council, that cost something in the region of £100,000, and yet they're closing 12 Mile, 30,000. It's a question of priorities and political judgment as well, because it's where we get our money from that we need to be asking. As an IGB board, that's not enough. It says quite clearly, if we don't make cuts, that X is going to happen. If we make the cuts or we don't make the cuts and we go into recovery or bankruptcy is the real term for it, the move and the weight goes on to other services, the NHS, hospitals, etc. It's so evident what needs to be done here. We need to start fighting for more funds from the Scottish Government. Money is getting wasted, and until you actually get a backbone and sit up and say to the government, we need more money, rather than cutting every time for another hit on unpaid carers. Thank you.
A couple of things on that, Willie. I think you've made a statement. That's your view. I'm not going to seek a response on that, but there is one thing I do need to clarify. When you referred to financial recovery being bankruptcy, I do need to correct that because bankruptcy doesn't apply in it. That's a very specific term that doesn't apply. So financial recovery is the correct term and it has very specific meaning for the IGB and for our financial position. So I think it is really important that we don't use the wrong language because they have different meanings, and it is the reason that we have a very detailed paper around what financial recovery means, because it has real implications for us. I think the rest of your comments I'll take as statements and I'll not seek to have a response on them. Do we have any other questions or comments on the financial recovery paper?
Thanks, Chair. I hesitated to come in because really so much has already been said that I agree with in terms of the quality of the paper. We haven't seen this before in the IJB, so starkly laid out of what financial recovery is and what it is not. And I particularly valued that absolute clarity and also the emphasis on prevention and the public health framework and the loss, if we were to go into financial recovery, even further impact on our ability to support preventative measures, which in terms of the health of the population is really key to sustainability and flourishing in Renfrewshire. So thank you for the paper. Thank you.
Again, Kath, I'm taking that just as a statement that you're not looking for a response on that. I don't see any other hands up in the room or online. This paper for all is detailed and really important for us, is really for information, and we are noting that today. There's a huge amount of information in it, and it does really help to clarify the responsibilities for us as a board. So on that, we are content to note the report and the contents of the impact assessment. Thank you. Thanks for bringing that to us. Okay, so that takes us on to item 8 of the agenda, which is the Sustainable Future Proposals. And I'm going to hand to Francis. Again, on this, there's a huge amount of detail in this. So at my request, I have asked that the team don't present the whole paper because then we will run out of time and we will lose either members of the public. So I'm trying to protect the discussion and questioning time rather than having the management team present to us. So Francis, I'm going to hand to you on this one. Thanks, Chair.
The main focus of this paper is to ask the IJB to further consider sustainable future saving proposals that were previously presented and discussed in September 2025 and in which no decision was reached on at that time. The paper does also update on the achievement of the agreed 25-26 Sustainable Future Savings, reflecting strong progress and over-delivery against the revised target set. In relation to the saving proposals for consideration today, the integrated impact assessments have all been reviewed and updated as detailed in section 4.2. And they also include a senior management team position statement, and they've been pulled out in the cover paper at section 9. Broadly, the proposals do remain the same as presented in 2025, with minimal material change to the proposal, with the exception of 2, older adults day services and Child Smile. The older adults day services has been updated to reflect valuable learning and experience from an unplanned closure of the Ralston Day Centre in December 25. Billy is going to provide an update on Child Smile after I present this, as there's been some recent developments in relation to the targeted approach model. Despite the limited changes made to the IIA, significant work has been undertaken to look at how we map and reflect the proposals against the IJB and HSCP strategic direction of travel. Furthermore, additional experience and learning over the last year has been incorporated as further evidence within the IIAs. It's asked that members consider these proposals alongside the wider context described in the last paper, which sets out the implications of financial recovery. Recognising that timely planning decisions provide the best opportunity to manage financial risk, reduce the impact of financial recovery, or perhaps even lessen the scale and intensity of any measures required. In this paper, the IGB are also being asked to approve the use of general reserves to fund one-off costs associated with the release of posts identified by the senior management team, aligned with the proposals if they're agreed at this meeting. And then finally, where proposals are approved, we want to reassure members that these will not happen overnight. Rather, we would begin a period of planning and engagement with staff, service users and carers to develop and deliver the proposals over the next 9 months. And I'll pass to Billy from Trials Mill before we open up to a wider conversation. Thanks.
Thanks, Frances. So members will be aware, but members of the public won't be aware that there have been a lot of recent correspondence and dialogue with Scottish Government about Child Smile. And yesterday we received correspondence that funding parameters will be changed to ring-fence the Child Smile funding, which would mean that any saving that would be made would go centrally. So given that would be the case, I suppose it removes that as an IJB decision. But what we've committed to, I've spoken to the Chief Dental Officer, I think what we've got is a very strong proposal around a more targeted approach that would really support the most vulnerable. You'll note that actually the saving involved is very minimal. Certainly from our perspective, it's not going to materially change the overall savings proposals. And so we're going to work with Scottish Government to review, test and evaluate the proposed model and have a look at what that brings out, and we'll bring any update back to the IJB, but we're not looking for a decision on that from the IJB today. Thanks.
Thank you, Billy. So when I do come to sum up in the recommendations, just to clarify, item 2.3.B, where it says Child Smile Model Redesign Appendix 5, that won't be part of today's decision. So that is removed from the recommendations, just to clarify the impact of that. Okay, thank you. Thank you for taking us through an overview and pointing out where the key changes are. There is a lot of information available around the impact assessments. There were easy read versions and summarised versions circulated both to members of the IGB and to public. So we've had lots of different ways to access this information. I think also just for the benefit, particularly of members of public, we as members of the board have had the opportunity to directly ask questions of the team to understand particular questions that we may have. And I know that everyone has had that opportunity and that's been made available to them over a number of months, actually. So there has been a great deal of debate and discussion and questions and information shared, which all of it is in the papers, so there's nothing behind closed doors, but often, depending on how your brain works, I like to talk and ask questions out loud rather than just reading, and I know a lot of people work like that. Okay, so I will pause at this point and take any questions, comments from the room or online. Willie, come to you first.
Thank you, Chair. I know you don't want to go through this particular item, you know, in full detail. Obviously, understand the amount that is within this particular item. So I'll try and sum it up as a whole, that will have several questions in it. From page 195, when I was reading right through all the way to 589. Within that space, there are something in the region of 15 negatives for unpaid carers. That's another 15 hits. We talk about a fair access policy. Where is it? What happens to carers after today, after a vote? It seems as though we have a plan, but we don't have a plan. The plan is we'll wait until we find out what happens with the plan today, and then we'll cross that bridge tomorrow that doesn't exist. You want carers to work with you. And you talk about consultation. From the carers that I've been speaking to, we don't know what consultation is going on here. Who with? Where? We were talking about easy documents and that. The people that I've been speaking to, unpaid carers in this room, are asking the very same question. What consultation? Last year, how many consultations have you come into the Renfrewshire Carer Centre to actually have dialogue with the carers? Never happened. We've been asking. We keep getting told, yeah, it'll happen, but nothing happens. This whole document here is about slash and burn. Again, it's about putting more pressure onto the carers' shoulders. This isn't just about money. This is about real life. People are dying. And we're evident in that in this room today. The stress and the strain that you place with your decisions in these chambers are killing people. I know there are people who'll disagree with that, but you're not the people that are dealing with the stress and the strain and the daily trials and tribulations that these cuts bring. So as a whole within this document, we can go through each item individually. Quite happy to do so, but it'll not finish at 12 o'clock. What I'm saying here is, and these proposals that are getting proposed today need to be rejected. You need to go back and have another think about this. The vote shouldn't be happening today. It should have been happening after the carers, the third sector and the service user reps get the vote. This seems to have been getting rushed through before that happens. So that's a statement from the unpaid carers. This is not a personal view. This is a view from many people who are feeling the pain. What we would like is answers. Fair access policy, where is it? What's the plan for carers after today? What help are you going to give? Because there's not getting any help now. And you're telling us there's going to be cuts. So we're asking you today, we're giving you a chance, speak to people and tell us what happens next.
Thanks, Willie. I've got your questions there. Billy, I'm going to hand to you to navigate through. I'll make sure that you're answering them because I think there's a few statements, but there are some specific questions in there that I think we need to pick up on. Thank you.
Yeah, thanks, Willie, for those questions. I'll take them in a slightly different order, if that's okay. So I'll just aim to address I think you described it as slash and burn decisions. And I suppose for us as a group of officers, and you've been involved in those discussions, Willie, as the carers rep, we as officers have looked at other options, and we brought forward other options to discuss with the IJB back very soon after September. But I think all of us recognise, both officers and IJB members, that actually the alternative proposals were even worse than what has been proposed. I think the other thing from our perspective is that the proposals aim to protect services. So the alternative is that we enter financial recovery quicker. That, as we've just been hearing, becomes unpredictable and potentially unsafe, and certainly will have an impact on unpaid carers and others across the system. So that's something that we're looking to avoid. We're looking to take a planned approach, and we believe that through those that we've coded green as officers, so we're making a strong recommendation about these are the right things to do in terms of where we're trying to get to in terms of the strategic direction of travel. So if I take a couple of examples, in terms of the way that we are delivering day supports to people are looking for a more flexible approach now, and we believe that we can deliver the effective services but on a smaller building footprint, so people will continue to receive care but in a different place and in a different way. What I would say though is recognising that short-term disruption in the way that people receive services, of course, will be unsettling for both carers and people who use services. So that brings us on to the other bit, which was about what's the plan to support carers, and I think you asked that up front. So at the moment, we have clearly not come out and had those conversations with individual carers and the people affected because the decision hasn't been made. So as the paper sets out, nothing immediate will happen on Monday. What we'll do is work through each of those proposals, and we'll work with individual carers and individual service users to make sure that people are supported through that transition to a new way of receiving services. And we'll do that in the way that we know we've done that very well in the past, where we've had similar service changes and service changes in service model. In terms of the consultation, it's something I value very strongly. You know that having come in as Chief Officer, that is something that I am looking to strengthen. It's something that I've been out speaking to people, and I know that 3 weeks ago, Willie, we had a meeting in the diary that the carers took out of the diary. Lisa and I had our time aside, ready to come and meet with carers and be able to answer some of those detailed questions. That door is open, and quite happy to meet with people as soon as is practical in terms of that. So I think that probably answers most of the questions. Access policy, I'll maybe come to Lisa on the access policy.
Fair access policy is something that's been worked on, but it will be a policy, really. So it'll be a high level policy, and then it'll be around the self-directed support and really what you should expect from Renfrewshire when you start to go through the self-directed support. I suppose the part from me and around, we talk about equity and so forth. So if we go through a fair access policy, people are getting self-directed support. If all our finances are all tied up in building services, others then don't have that choice and don't have that control of their own budget, because we won't have the money to give them to choose alternative methods. So this way, we're trying to create fair access to all services and to all community and building-based services across Renfrewshire. But we are working on that, and when that comes through, we'll absolutely make that available to everybody, and it'll be published online as well. But we have to get it right, so we are working on it, and we're looking at what other areas do, as well as individual guidance for each of the service areas and for each of the workers.
Thank you, Lisa. And it probably falls to me to pick up on the point around rushing today's agenda item through ahead of changing voting rights. I've picked this up at previous IGBs in public and in private session with members. The change to voting rights is happening. The timetables for that have been happening out with our control. The plan to bring this agenda item has been in place for some time, and we have contributed to and are very open to the extension of member voting rights. So, but we are not in a position to wait until legislation or whatever comes around voting right changes to make decisions. So the two things, one is not waiting in the other, they are entirely separate items, and we have spoken about that quite openly in previous meetings. I have Ian McMillan to bring in next. Ian.
Thanks, Chair. Earlier on, I'd sent an amendment to the clerk. So I'm going to move that amendment. I don't have a seconder as yet, but if I can read it out, if I get a seconder, fine. If it falls, fine. But then I'll obviously speak to that as well, if that's okay.
Yeah, if you could, Ian, the reason I thought it'd be helpful for you to read out, we've got a real mix of people.
Yeah, absolutely.
Online, with laptops, not laptops, so reading it out, everyone can access.
Yeah.
Thank you.
Yeah. Right. What I've got down here, if you don't mind me just reading out over my phone, it's basically to replace all the recommendations that are in the paper with the following. The IGB acknowledges that the impact of service changes and reductions will adversely affect people in our community, many of whom are some of the most vulnerable in Renfrewshire. While acknowledging the financial challenges ahead, the IGB will therefore delay the financial decision on service restructuring, pending meaningful consultation with partners at Renfrewshire Council and Scottish Government about alternative solutions and funding options to preserve provision in our community. The IGB further agrees to work closely with all stakeholders on identifying efficiencies within the frontline services in line with the principles of public sector reform being undertaken by Ivan McKee, MSP. So if I can get a seconder, I'm seeking a seconder for that, so I will hold my breath until I get a seconder. If I don't, then I would like to speak further, not only to my amendment, but actually on the wider issue as well. Thank you.
So thank you. So at that point, can I just check, are members either online or in the room content that they heard Ian's statement? And I'll pause and then confirm, do we have a seconder? There are no hands up and no seconding. So Ian, the matter falls that you've raised, but I'm content you can raise questions separately.
Okay, well,
thank you.
Well, thanks very much. The reason for moving that amendment was because we have a new government in place. Although it's the same political party, but it's a different government, and certainly they've put public sector reform at the heart of their agenda. To be fair, they had that in their manifesto, and people voted for them. So I'm assuming that will be carried out. I do not want to make these changes to services whilst that is looming in the background, and I would hope that anything that happens later on in this agenda item we don't live to regret, because things happen and change in the weeks and months to come. So that's my main reason for moving the amendment. But if you bear with me, I'll just run through it, and as Willie said, this is a massive paper. And first of all, can I thank the staff for producing this? And as Billy had mentioned, and Mags had mentioned, that we've had the access to these papers for a considerable length of time. So when this 916 pages dropped on my desk, it wasn't a total surprise, because I had read a lot of the stuff before it had been presented at development days. And for members of the public, we don't just turn up here every 2 or 3 months. There's a lot of work goes on in the background, and certainly as an IGB member, I've got access to officers. They come along to our political groups and speak to us. So it's not just we're making up our mind now. This has been a long time coming, and obviously it came to us in September. So we've been through this situation before, and although there's been minor changes, it's fundamentally the same papers as presented in September. I've spent the last wee while speaking to a lot of people, and a lot of people have contacted me. So if you don't mind, just bear with me. Some of the people who have contacted me have been carers themselves, professional people who work in the care service, as well as people who are carers and unpaid carers. And there's a concern here about, if these changes happen, the impact on other policies within the council and in the HSCP. There's a question over, will it limit people's independence? We always talk about people being enabled and empowered. Will these proposals impact that? There's no doubt in my mind this will increase loneliness and isolation, which maybe lead to higher costs later on down the line for primary care. There will be increased pressure on increased pressure financially on relatives. Now, Willie mentioned this earlier on, and I'm going to be honest, we have voted for these things, but we did find extra money for a new school in Dargavel. We found extra money to make sure the museum it gets opened. And of course, as Willie mentioned, both the council staff and the health service staff had a holiday, and I voted for that as well. But we found the money for it. So it begs the question, if we can find money for all these things, and they're all important things, maybe not so much the holiday for the football, but they're all important things, but this is also important. So why can't money be found for this? There's a question as why, when they were not accepted before, I know it was a draw the last time, but why are they still on the table when they accepted the last time? Have we ever considered charging? And I know that's a controversial statement in itself, to charge for services. Are we doing enough to promote these services for teenagers who are moving into adult services, like daycare centres? Is that been pushed as an option for people. And again, impact on carers. I keep reading through the papers, we can have digital services. I'm not entirely sure if that's the answer for a lot of people. And of course, there could be higher costs down the line. Question was asked is, do the care inspector, are they quite happy with these proposals? At this point, I was going to pick out a couple of the service changes, and one of the ones I was featuring was Child Smile, but that's kind of off the table now. So the other bit here I maybe have to do on the hoof. I'll try my best. But one of the issues I'm concerned about them all, but the autism connections. Had several people on the phone to me about that, and everybody knows the increase in the diagnosis of autism amongst children. And of course, those children will not be children for very long. They'll be moving in to adult services before we know it. In 524, it's talking about the various impacts if we take away autism connections. And I was a bit concerned about how we're talking about there's no impact on those with low wealth. There's no impact, no direct impact on material deprivation. I don't buy that at all. And I'll tell you why I don't buy that, because one person told me that he was only in work because of autism connections. So therefore, if it wasn't for autism connections, he wouldn't have been in work. So therefore, he'd have been deprived. He wouldn't have been able to go out and work. And I'm not only just talking about financial circumstances, just being out and being part of the community. The other issue I'll talk about is respite, because I had a number of calls from people who were talking about how the respite, in some cases, or certainly in one case, it's going to be halved. Now, this person depends on the respite. We all know, we've discussed it umpteen times, how important respite is to people. This is people's lifelines. And if this goes ahead, we're dramatically cutting. I know we're trying to equalise the service. There's some people that don't get very much respite, but we're still going to be cutting people's respite. And that's something I just can't live with. Now, I'm going to finish, and thanks for giving me a bit of time here. I'm going to finish with two quotes. And one is from Angela Constance, who's the Cabinet Secretary for Health and Care. And she recently said, when discussing changes to services, we must put the needs of local people, particularly those who are most vulnerable, at the centre of those discussions. And the second quote I'm going to mention, and I've got John's permission, we mentioned Helen, who sadly passed away a few months ago, and I'm going to quote her, and I'm going to finish on this. So before we start to take votes on the salami slicing of services within Renfrewshire, Renfrewshire has been so proud to have to. Oh, hold on, I've got this completely wrong. Listen, if you don't mind, I'm just going to read this out properly on my phone. Sorry about this. No, it's all right. It's fine. I'll get it. Right. So before we start to take votes on the salami slicing of services, which Renfrewshire has been so proud to have, take a moment and think about what society we want Renfrewshire to have. Do we want the most vulnerable to lose services? Cast them to the wind and ask carers to shoulder a heavier task for their loved ones. So before we make any decision on this, I just want you to bear those thoughts in mind. And my final statement is, it doesn't have to be this way. Thank you.
Ian, I think you've covered a lot there. There are some specifics that I will ask Billy to pick up on. I think in terms of there's a few items that there's some general comments that we'll not respond on. I'm sure you know, but I think there's a few things probably, Billy, you want to pick up on.
Yeah, there was a lot there, Ian, so forgive me if I've missed anything, and hopefully I can cover most things, but I think we've covered some of them along the way. Just regarding the initial amendment around conversation with the council and Scottish Government. We have had those conversations, and with the NHS as well. So that is something that continues and will be an ongoing process. Our commitment around public sector reform, that is absolutely central to the redesign that we've presented as a team. So there's not been lots of detail come to the public IJB yet around that, but as we develop our strategic plan, we've got that as a later item over the coming year. That consultation that you talked about, that will all be part of what does that future model need to look like. From my perspective, keeping it at a high level, those proposals that we are coding green, as an officer group, what we're saying is we are strongly recommending those because they are the right thing to do. Even if we had the money, which no government, in my view, will have over the next 20 years as demographics change, demand will increase, tax intake will reduce. So there are decisions within that, of course, but this is about shifting our model into a new way of doing things. So some of those changes are about how do we, as you said, enable people work in a more holistic way with the individual, and that's why we're seeing shifts in demand for some of those services, and that's why we are proposing that we need to modernise and remodel services going forward. In terms of charging, we are charging. We have already introduced that. The Care Inspectorate, whilst we are delivering good quality services, which we believe, again, these proposals mean that we will be able to continue to do. And if we go into financial recovery, we would find that we would be less able to do. I think the Care Inspectorate, we've not had that discussion, but I'm sure would be comfortable with what's being proposed. In terms of autism connections, I know that having spoken to the team and we got a detailed discussion with the team at one of our development sessions as you were involved in, we know that autism connections is about strengthening training and support for existing staff. It's the belief of our senior team now that that work has been done and that our core team are able to provide that level of support now to those who require it, and therefore the skills are in place within the core team in a way that there weren't when that team was first introduced. I think, respite was the other specific probably worth picking up. I do recognise that for some people that, as you read out there, Ian, for some people it will mean a reduction in respite. But what the proposal does is brings that fair access. At the moment, there are some people who are not able to access respite, whilst others access over 50 days. So this is about bringing us in line with what has happened elsewhere across Scotland in other partnerships, and trying to bring a more fair approach to the way that people access respite. Hopefully that addresses most of the points and questions that you raised. Thanks.
Thank you, Billy. I've got Jacqueline, then Kath, then Willie. Jacqueline.
Thanks, Chair. Yeah, I just wanted to say to Ian, I've got a lot of sympathy with your amendment. As you know, I brought practically the exact same one to the board in September last year. And as you say, we did have conversations, Billy. I was saying we talked to Scottish Government, we've talked to Council, NHS, and COSLA have been banging the drum for more funding and, you know, changes to the way that we're funded for a long time. And as we saw in the paper earlier, they continue to do that. But here we are, months on, and we're in the exact same position. In fact, we're in a worse position in terms of our reserves, and, you know, not just financially precarious, but just the landscape is a fragile situation. And I think the financial recovery paper was so important, because what we need to understand is that the people who are here today wanting to protect their services, if we go into financial recovery, we can't guarantee that those services are going to be protected. But in this manner, we can look at it in a planned way, we can have dialogue, and we can think about the future and shape it in the way that we want, rather than just going into it blind. So it's a horrible position for us to be in, and I want everyone to know, members of the public, that we don't want to be in this position, but the landscape is the way it is. And a lot of sympathy, but I think that we've got to the stage now where we need to plan this, and we need to plan it carefully. Thanks.
Thanks, Jacqueline. I don't think you were looking for a response on that. Apologies, Kath. I actually think Willie had his hand, so I'm going to come to Willie because yours was a yellow hand Willie had an actual hand. Come to you first, Willie, then Kath.
Thank you, Chair. First of all, I wish to thank Ian. Thank you for your courage in presenting that amendment. I was just disappointed that nobody came up as a seconder. I have a concern. It was a comment that you made yourself, Billy, prior to Ian's discussion there, when I was asking the question, what next? What plans have you got? Because there's nothing going on. It seems that we'll cross that bridge when it happens. You know, fair access. Yeah, we'll think about it. We'll sort something out. We're here today, effectively, on what's supposed to be a democratic vote to go through for these changes. But there was a comment that you said, we have everything in place on Monday. And I think from the carers, we
don't.
No, it starts on Monday.
No.
Okay.
So just to clarify what I said, Willie, what you presented or what you asked me was what it felt like was you were looking for a plan around what would happen first, second and third around each of these proposals. What I'm saying is you're absolutely right. We don't have a plan about what happens first, second and third. It will not be starting on Monday. What we will do is begin those so if these are voted through as decisions, each of those proposals will be taken forward in its own way. It will have a project management support, and heads of service will support their teams to make sure that each individual is supported through that process. So that's what I was saying. So there isn't that. So nothing starts on Monday, I suppose, is what I was saying.
Yeah, had I been given the courtesy to finish what I was going to finally say within that, it sounds as though the decision has already been made, that it's a predetermined decision. And that is the feeling that we have from all the unpaid carers I've been speaking to.
So, well, can I just come in that? I think I actually have to be really clear on this. No decision is made until we make the decision. And I think the good evidence of that is we were in a very similar position in September and we did not make a decision and changes didn't happen. So be reassured that that is the process that we are following, and you have been party to all of those discussions, and you know that the team do not make changes until they get approval or otherwise. So let's be very clear on that. And I think the reason I asked you to pause was I didn't feel I was being disrespectful. It was for clarity, because I think it's really important that people understand what we're effectively telling the teams to go ahead next week to do or not. And I think if you reflect on last September, things were not in track because the decision hadn't been made. So I think it's really important that we put, and that's why I just wanted to pause rather than continue a conversation that might have implied something different. Okay, thank you. Billy wants to come back in.
Yeah, sorry, just to really emphasise that point, Willie, absolutely, we are not predetermining a decision. And to emphasise that, we have a meeting on Wednesday as a senior team where we don't know what the decision will be today, but we know what we will need to do is in that meeting, either be planning to start working with people into the transition into the decisions that are made today, or begin to prepare for financial recovery and be able to bring back what that will look like next to the next IJB. So those are our two scenario plannings, which is why you've got those two papers in front of you today. Thanks.
Thank you, that's helpful. Kath, you were next, I'll bring you in now.
Thanks, Chair. I mean, such a difficult position that we find ourselves in, and I just wanted to respond a bit to some of the sense in the room earlier, that sitting here as someone who has been motivated in my life to be a public service individual for the greater good, this is a really, really tough space to be. And I know I'm not alone in that, and I've heard this from others, and Jacqueline in particular, what you just said really spoke to me too. In the paper, it outlines, and Francis, in your introduction, you said that broadly the proposals are very similar to what came forward in September. And when I look at what we just heard around the financial recovery paper and the implications of that, and in point 6.2, this reflects the SMT considering all proposals as safer alternatives to moving into financial recovery. This is where we stand. So my question to you, Billy, at this point is, what has been the financial cost if the decision is taken to move ahead today, and everything that's just been laid out is really important, what's been the financial gap from the decision that may be taken today if it's different from what it was in September?
Yeah, thanks for the question, Kath. And it was something I nearly responded to Jacqueline's comments around. So in terms of the gap since September, Sarah will be able to calculate that better than I will. But if we take it back to a 2-year point, so if we say that these proposals have been considered over a 2-year period, then the missed opportunity in our reserves is around £5 million. That's just in terms of the cash missed opportunity, which would have given us much more headroom now in order that we can make the changes to services that we require. That's been and gone. That's a decision that we obviously didn't take 2 years ago. But that's just the cash side of things. There's a missed opportunity in terms of team time. So whilst we continue to work on these proposals, the team is not working on what does that new model look like and being able to engage in things like the public sector reform work, the really upstream work that we are requiring to do in terms of shifting the balance. So there are opportunity costs around this, both in terms of financial and in terms of officer time.
Thank you. I don't see any other hands up or online. So I'm going to move to the recommendations at this point, and I will.
Chair, see, before you have been down this road before, but I would want my dissent to be recorded on the minute, on that reflected in a minute. Thank you.
Nods from there. Okay. So I'm going to go through the recommendations just so that we're really clear. I don't often read them in detail, but I will go through. So this is at section 2 of the paper. So the recommendations are that we note the update provided on the delivery of agreed savings for the full financial year 25-26. We note the updates made to the integrated impact assessments and the position statements provided. Then at point 3, we go on to approve. So I'm just making sure that everyone is content that they're clear on this. We are approving the proposal set out in section 5 to 6, which deliver service change or reduction in alignment with national and or local policy directions as described in the SMT commentary provided. And these include first point, redesign of older adults day services model, the redesign of learning disability and physical disability day services model, the review of learning disability respite and closure of flexicare. We then go on to item 4, where we are approving the health visiting proposal set out in section 5 to 6, which delivers efficiency through management action. Item 5, we're approving the proposal set out in 5 and 6, where service removal will enable a reduction in spend, reflecting the recognised impact described in the SMT commentary provided. So this includes the closure of autism connections and the removal of the assertive outreach model. And final item of approval is approve use of general reserves to fund the one-off costs associated with the release of posts identified by the SMT aligned with the proposals above. Then finally, we're noting the early plan decisions, such as the savings under consideration today, provide the best opportunity to manage financial risks, protect services and retain local control. The partnership will continue to identify opportunities to slow spend as far as possible to manage the projected funding gap for the current year 26-27. Okay, so that item is now concluded. Thank you very much, everyone, for that. I was just pausing just to make sure that everyone is clear that that item is now agreed. Okay. Thank you all very much for that. And thank you for everyone's contributions. I know this has been a difficult process for everyone involved, so thank you all very much. That moves us on to item 9 of today's agenda. So we have an update on the development of the IGB strategic plan. And I'm going to hand to Frances to introduce that. Thank you.
Thanks, Chair. This paper sets out the proposed approach for developing a new 10-year IGB strategic plan in line with the statutory process, reflecting a desire to better align with national and partner organisation frameworks and plans, and also reflecting recommendations from a recent audit of the 25 to 27 refresh of the strategic plan. Just a few points that I would want to highlight from this. While the paper seeks to approve to extend the current strategic plan from March to September 27, I just wanted members to be assured that that's still within the statutory timeline in which we must review the strategic plan. Also, although the proposal would be for the plan for 10 years, there would be an intention to refresh the joint strategic needs analysis more frequently and also develop supporting delivery plans every 3 years with regular monitoring. Also central to the development of this plan is improved partnership approach across the whole system. So that includes collaborative work in how we develop the joint strategic needs analysis and improve in how we engage with communities, placing the voices of people with lived experience at the centre of our plans. And building on that, section 9 of the report sets out the work to develop a supporting participation, engagement and communication strategy. And this work's already underway and is exploring the most effective structures to support more direct involvement from a wide range of stakeholders and promoting a culture beyond just the development of the strategic plan and more about continuous engagement. And it aims to ensure that people that are most impacted by our service are actively encouraged to participate and shape our services from the outset. Thanks.
Thanks very much, Frances, for that. I'm conscious, before I open up for questions, I'm conscious some of the members of the public look like you want to leave. You're welcome to stay, you're welcome to leave. So it's just in case you felt that you couldn't move during discussions, it's fine. We've still got quite a lot of business, so I'm not going to pause, but feel free to come and go. But I hope that's helpful. You don't need my permission to move, don't worry. Thank you very much for coming. I do appreciate that. And Frances, we'll open up for questions on your paper while there's a bit of movement in the background. I don't see any questions or comments. I think I'm not surprised at that because we have had discussions around this proposal a few times before. So the board has been asked to approve the approach to the strategic plan and the timing to September next year. So with no other comments, we approve that paper. Thank you, Frances. That takes us to item 10 on the agenda, which is the draft annual performance report. Still with you, Frances?
Yeah, thank you. So this paper presents the 25-26 annual performance report for members' approval. The cover paper summarises our overall performance against both the performance scorecard and also progress made over the year for the 25-27 strategic plan. Similar to the other papers, I'm not going to go into the detail, but there's just a couple of key messages that I'd pull out and highlight to members. The positive, sustained, strong performance that we've got in a challenging operating context, and that's notable with the green status indicators across our scorecard, building on our mid-year update. It's also in terms of the delivery of the strategic plan, really positive progress with 95% of our deliverables on target or fully complete. And while the number of red indicators has decreased by one since mid-year, we've got really clear improvement activity for the 5 red indicators. And there's a particular focus, as members will be aware from previous meetings, around staff absence for both our NHS and council employees, and we've covered that at a number of meetings before. So finally, it's just to say I hope that this, by bringing it in one document, the performance data, the service development work and a range of illustrative case studies, the report demonstrates both the quality and breadth of support and person-centred care that we continue to deliver in spite of the well-documented system pressures that we've discussed today. Thanks.
Thanks very much, Frances. There's a huge amount of information in the report, and it is information that we see building up throughout the year, but it's really helpful to see in one place. So we are seeking approval of this report today. So I'll open up for any questions or comments on the report. Willie, bring you in.
Thank you, Chair. An overall question with regards to the, your 10-year plan, etc. What extra support is the IGB going to be putting in to give the Renfrewshire Carer Centre and other partners, with the additional influx of people that they're now going to that they may well receive with the closure of community services? How does that fit in with the plan?
Willie, we're on item 10 at the draft annual performance report. Is your question related to the strategic plan?
Sorry, yeah, there was. Retract that.
So, okay. Yeah, we've approved item 9, so we're on item 10. No questions or comments on that. I mean, I think there's a wealth of information in it. I say a lot of this is the things that we regularly discuss and report on, but it is great to see it all in one place. And I actually think is really helpful to see. So thank you for all the work that's gone into that. And so as a board, I think we're content to approve. Okay, thank you. Which then takes us to item 11 of today's agenda, and we've got Renfrewshire's Children's Services Partnership Plan. Hand to John for this one. Thank you.
Thank you, Chair. And this report is for noting by the IJB, but I thought it was probably important just to outline why it's here. The report is the Renfrewshire Children's Services Planning Partnerships Strategic Plan. We're required on that partnership to produce a 3-year plan. We've taken the unusual step of only producing a 1-year interim plan, and that's on the basis that we want to align our planning framework across all of the services, so the council plan, the strategic plan for the health and social care partnership, the council's community plan, to the same time frame, because otherwise we're operating in different ways. The plan is required to be produced by the Council and NHS Greater Glasgow and Clyde Board. And obviously the partnership staff have contributed to the development of that plan. We had a strategic needs assessment. We've agreed some priorities. Those priorities are in paragraph 1.3 on page 707 of the papers. We took account of the child's needs assessment, child's voice. We highlighted in the plan the pressures on children's wellbeing and development, safety and relationships which matter, access to support actually not being equitable across the council. What we're trying to do is make sure it's more equitable as we go forward. And then from page 776, we have some actions that we will take as a partnership. The partnership plan is not about individual agencies, it's about what we will do together. So it's slightly different from the development of some of the services that you would normally see. And just before I finish, Chair, just to highlight that the children's care planning Children's Services Planning Scotland Act, which was received royal assent a few weeks ago, actually will make the IJB a strategic partner who will also be in future plans required to contribute to that. And I think that just changes the status for any future reports that we would bring. We don't have we don't have an enactment date, that's not easy to say, for that part of the legislation, but it will change, and I'm happy to take any questions, Chair. Thanks.
Thanks, John. Thanks for the clarification of the role of that. And I think we just obviously need to keep an open eye as to the timing of that impact. Willie, bring you in.
Sorry. Yeah, it's the plan is. I've been asked to present a question on this, and it's just it's a short question actually. It seems to be every year, or each IJB meeting, children's services there's an underspend. So the question is saying, how can we make the plan work when children's services are always underspent, as shown in the IJB paperwork for the past few meetings? Now, we asked at the last IJB meeting when there was a underspend on the children's services, what happened to that money? And they were then told that it was Western Bartonshire that hold the funds for that.
Willie, I'm going to get Sarah to come in if that's okay. Yeah, Sarah, thank you.
There just seems to be a bit of confusion there, but
there's two elements to that, really. So Western Bartonshire hold the funding and manage the services for CAMS and Specialist Children's Services. So we don't have that budget. What we have is the general health community services children's budget, which does have a small underspend at the moment, and that goes to the bottom line and helps fund overspends within other areas of the IJB budget.
And it's worth just as a reminder, not all children's services, most children's services remain within the council. So John, could you maybe just clarify
could I just quickly answer? So if there is an underspend on the children's services, that is then going into the fund in the IJB for adults?
Yes, that's correct. And vice versa.
So Chair, yes, the partnership plan, remember, is about what we do together to achieve improved outcomes for children. And most local authorities and health and social care partnerships will at different times have overspends or underspends in their budgets for particular services, and they will use those to develop the best approaches across for children. And whilst the plan talks about children's services, actually an important element is the adult services that the Health and Social Care Partnership actually deliver. So for example, good quality mental health services for adults, or alcohol and drug recovery services, or physical disability services means that parents can continue to look after their children safely and help children on that journey. So I think it is complicated, but they're not directly related. And I think, just to give an assurance, Renfrewshire has a good track record of making a difference for children. I'm very ambitious for Renfrewshire's children. I want us to have the best children's outcomes across Scotland. We've not yet got there, but we're making really good progress. And we do that because on a day-to-day basis, staff in children's social work, in education, children's health services and the third sector, our housing colleagues, our employability services, all work together to try and improve children's lives. Thanks, Chair.
Thank you, John. I don't see any other hands or questions. That certainly I welcome that better alignment across all bodies. I think that has to be, I mean, we're an integration joint board, you would expect me to say that, but I think particularly for children, all the evidence suggests that that is the correct way forward. So that's, I guess, my contribution to that. Thank you very much for the report. We are noting it today. It's not for approval, but it's a really helpful report for us to see. Thank you. That takes us to item 12 of the agenda. So we've got keeping the roads in Renfrewshire, and that's a progress report, and I'll come to Pauline for that.
Hi, thanks, Chair. Again, this report's for noting, and I wasn't intending going through it all, but picking out some key points. And I think it follows on from John's quite nicely in relation to our update, an updated report around how we keep the promise. Similarly, as before, the promise is our priority within the Children's Services Partnership, of which the HSCP is a key partner and is involved both in the strategic delivery of the promise and the aims of the promise, but also in operational delivery. The paper pulls out the HSCP parts within that, but the full report behind that gives the whole partnership approach, and you can see through education, health services, social care services, third sector, all the work that's happening to keep our children safe, well loved and respected, using the within the 5 areas of the promise, and notwithstanding our universal services that hold the scaffolding of how we make sure that stigma and services are available and people are assessed for additional support as and well as needed. Throughout this, you'll see that we absolutely look at early intervention pathways, and we're very astute with our financial inclusion and advocacy. And as John mentioned, mental health support to make sure that our children receive the best care. Additionally, our Promise Keeper network is improving and increasing year on year, and that includes members of the SMT staff as well as right through our organisation. You'll see staff members raising their hands and wanting to become a Promise Keeper, and that absolutely helps with our language and our implementation of that promise. Happy to take any questions, and I'm sure John will jump in as well if there's anything or any comments anybody wants to make.
Thank you, Pauline. Thanks for introducing the report. I've got Ian first. Ian, thank you.
No, I just want to very briefly welcome the report. And you know, I was a long time ago used to be convening a social work, and in the days it was children's champions, I think it was, where various people of the management team and councillors became champions and regularly met with the young people. I'm not entirely sure if it was the greatest model, but certainly for me it was certainly educating, and it was great to go out and meet the young people. It sometimes could be a bit awkward at times. So things have moved on considerably, and as we mentioned earlier on, everybody all working together on children's services is obviously the best thing to do. And as I say, I'm on the Education Policy Board as well, which looks at children's services, and it's not just all about schools. Although it's a big thing, obviously school is a big part of it, but outside of school, other issues are going on. And I think we know the issues that a lot of children are facing now. There's obviously sexual exploitation. We're going to be getting a report on that fairly soon, and I welcome eventually getting round to doing that. And of course, we had the issue earlier on in the week about these phones. The impact in people's mental health, our children's mental health, sitting staring at a phone for 8-9 hours a day is absolutely incredible. Now, most of us are of the generation where we didn't have phones when we were younger, and I'm sure we probably look at them more than we should now that they were adults. But I would like to think that none of us are actually sitting for 9 hours a day. Now, that we all know, and I mentioned it earlier on, how quickly childhood passes by, and you become an adult and you get into the big horrible world that is the adult world. For these children, very, very quickly to lose their childhood, the experiences that we had out playing and reading books, listening to music, hanging about with your pals, nowadays is just on a phone. It just bewilders me. Now, I've got granddaughters who do that, so I'm not coming for any position of high moral authority. I know what happens in my own family, and I must admit I still bump into some of our care experienced kids in Johnson when I'm going about. They always stop to say hello, so that's really nice. So everything that we can do to help kids who are care experienced, I'm all for. I don't think we can do enough for them, and I'm glad to see the promise is developing and continuing to grow. Thank you.
Thanks, Ian. I don't think you're not looking for a response on any of that. Bring Jamie in now.
Yeah, thank you for the report. Kind of feel aware that it's not strictly our report that's been written by people here, so maybe it's more of like a how rather than a explain it here. I think what's really clear in the report is like if the spirit of the promise is like try stuff, do stuff, get involved, look at things in a different direction, then this is a report that really meets that. My understanding is that where the promise is at now is now saying, and what has been the impact of all of this? So what? That kind of like part, because we're now 6.5 years into some activity, some stuff ought to have bedded in by this point. If it's all it takes ages to turn a ship around, okay, is 6.5 years long enough to turn a ship around? So one of the things I thought about was that quite a lot of the next steps that are noted in the report they start with language like continue, develop, deepen, monitor. There's loads of numbers in there about the amount of people that participate in a thing, do a thing, get a thing, and what I felt perhaps the report was a bit short on was the so what component of all of that. So I think my question is, because it's not whether there's impact, it's probably going to be how. I'm working on that assumption that there is impact that's coming from lots of those numbers and things. I think my question is about how can we, as the promise moves into now its final 3.5 years, how can we influence future reports like this to lean much more heavily on demonstrating the impact of what's happening with a bit less of the explaining the variety of activity that's happening?
Oh, John, thank you.
Thanks, Chair. And Jamie, that's a brilliant question. And I think what we try to do in this report is summarise the bit of the journey that Renfrewshire's been on. And in terms of, I think, the story, you're absolutely correct. So some things that I can just say, so Renfrewshire has looked at issues around how our care experience community and children, young people are supported in school, but also looking at the experience that parents who have care experience actually had in their school days. We can't undo it, but actually trying to make sure that schools are better places. Now, some of that is very much a sort of, it's an individual story, so it's difficult to gather numbers. And I think that's one of the challenges we have. But I would say to you that Renfrewshire is one of the councils in Scotland that has embraced fully the continuing care agenda. That was an important agenda. It was about ensuring that children who were looked after in alternative family care or out of family care actually are continued to be supported through 18 to 21. Renfrewshire made a clear commitment on that. We pay an allowance that most other councils don't. We have children and young people, we have young adults now who are in our children's houses supported to stay there till they're 21. They're not chased out. Kinship carers are supported to make sure that they can continue to look after children and young people. It's difficult to aggregate up, I think, the impact locally of, for example, health improvements for our care experience community, because there are about 600 young people currently in the system. So how can you aggregate up that 600 without it being clearer? So I think nationally we are trying to look at how do we report those improvements. I think for me, what I see is a clear commitment from all services to make sure that opportunities are available. And I'll just give you an example. I'll give you one example. We had a young man in one of our children's houses who came into care quite late, the day before his 16th birthday. Very unusual. And he has made some requests about how he gets support to undertake an apprenticeship. This council doesn't have a family firm approach because we think that's wrong. So what we do is we work individually, and immediately staff flexed across all the council organisation to get that young man a pre-apprenticeship year, because he missed the apprenticeship year, but they have a pre-apprenticeship year, which I think will mean he ultimately will get an apprenticeship next year, round about August, September time, and we hope that will then bring him stability, you know, the ability to live in a safe place. So we try and gather all that, but what I will do is perhaps meet with you out of this meeting and look at some of your own suggestions about how we could improve that, and bring Morris, who is the Promise manager, along to that meeting, so we can look at how do we improve the reporting as we go forward.
Yeah, thank you. Thank you for raising that, Jamie. And I think the essence of your question is, yeah, and then don't just give us facts and figures, and that it's the detail and the impact of it. Thank you very much for the detailed response. I'm looking for no more questions. Thank you. I don't see any other hands on that. So on this report, we're just noting the report today and note the comments made from Pauline and John. That takes us to item 13 of the agenda. So we're on the annual update and the delivery of the NHS primary care strategy. And I'm handing to Fraser on this one. Welcome, Fraser.
Thank you, Chair, and thank you for having me again. So I'm aware that you're tight for time, and as per the previous paper, there's no direction required on this one. It is for noting. However, there are two broad aspects. The first is the board's strategic plan around primary care strategy, which is a 5-year plan, and then secondly an update on Renfrewshire HSCP's tracker for PCIP. So very briefly, in terms of the primary care strategy aspect, the paper outlines a number of the areas that we've made significant progress on, including our comms and engagement, workforce and IT, and also areas that are priorities for us for this forthcoming year, including further development of workforce and urgent care. And then the primary care improvement plan update provides members with an update on the workforce and activity that's been undertaken, again, including some of the opportunities and some of the challenges in that regard. So I will leave it there, Chair, but happy to take any questions and comments. Thanks.
Thank you, Fraser. So just clarify, so the report is for noting both against the strategy set between 24 and 29 and the tracker for the improvement plan. So open up to any questions on that. There's quite a lot of detail in the report. Don't have any questions on that. So we're content as a board to note that report. Thank you for being available for questions, Fraser. Thank you.
That's great. Thank you. Sorry, my phone went off there. Thanks, Chair.
No, we didn't hear. That's okay. That brings us to item 14 of the agenda, and it's an update from the board's Audit, Risk and Scrutiny Committee. So I'll come to Lisa Marie for that. Thank you.
Thanks, Mags. Excuse my voice. In the interest of being brief, I'll just pick up a couple of things from the committee meeting, although it was a really full meeting with a whole suite of papers from Internal Audit, RCF and our CFO. I suppose one to highlight is that the unaudited annual governance statement was presented. We approved it and it noted a reasonable assurance. Obviously, that's incredibly important for us and how we move along. And alongside that, we had the local code and sources of assurance for governance, and these very much work together in terms of the work we're doing and underpinning. There were the usual updates on things like risk and the health and care staffing Scotland implementation assurance and reporting papers for both health and social care, both of which are statutory reports with lots of detail on how we support assurance around staff and lots of work across the teams. And I just wanted to highlight that we had a really excellent report on a fantastic mental welfare commission visit to Ward 39 at the RAH. At numerous points of good practice and positive comments and absolutely no recommendations. That's quite rare, so I think important to highlight it in the main meeting. And then finally we had the annual report, which is before you, and if anyone has any questions on that, they can ask James.
Thanks, Lisa Marie. That's a really helpful run through, and thanks for highlighting a very positive inspection. I think for those who don't sit on that committee, all inspection reports and actions flow through the Audit, Risk and Scrutiny Committee. But actually, there's nothing more positive than a report with no actions on it. So thank you very much for highlighting that in this meeting. I'll open up for any questions or comments to the chair. No, thank you. So we're actually noting and approving this report, albeit it is the Audit, Risk and Scrutiny Committee's report, but then it formally feeds into our assurance statement. So thank you to Lisa Marie and to the members of that committee for that report. Thank you. That takes us to item 15 of the agenda, and Nairn, it's just on the dates for our next meetings. Thank you.
Yes, the recommendations here are just to approve dates and times as set out in the report for meetings in 26-27, and also to agree that the meetings of the IGB will continue to be hybrid meetings held both here in the chamber and also online.
Thanks, Nairn. The dates are there. Hopefully pop those in your diary to hold them as much as you can. I think we have had lots of discussions about what's the right place, the wrong place, but actually the technology works really well here, which is great, which is not true of all locations. And actually, I know from members being unable to attend in person, it really does demonstrate an accessible board. So I'm really welcoming of our continuation of the hybrid model. So I really welcome that as chair. So don't see any questions or comments, so we're content to approve that. Thank you, Nairn. Okay, thank you very much. So there is one final item, which is not a formal agenda item today. So before we close formally, I'd like to take a moment to mention that this is the final IGB for one of our colleagues. I don't know if she's new. The penny slowly dropped. You don't have the minutes, Elaine. Yeah, you don't need to minute this. You were furiously minuting, not realising I'm talking about you. Nairn, take notes on this. So you're moving towards well-earned retirement. So way from the very first IGB, long before my involvement, Elaine, you've been a key part of how this board operates. So over that time, I didn't know this, you've supported more than 50 IGB meetings. That's a lot of IGB meetings, numerous audit committees, and guided us through significant changes, including that move to the virtual environment that we're in now and hybrid working, which takes a lot of work in the background. Lots of hours of preparation and coordination behind the scenes. I and many others see it. A lot of that work isn't visible to members of the public or some of the attendees, but the impact really makes a difference. It means the meetings run smoothly. You carefully plan, you're organised, you've got a good attention to detail, you just ensure everything runs smoothly, you check nameplates, you do all of this in the background just to make sure that things are working. But you bring professionalism, knowledge, you're very consistent in everything that you do. And also you're friendly and you're warm and you're kind and you check in on us. That's really, you do have a sense of humour. Yeah, you do, you need it. And you do gentle reminding of, well, maybe Margaret, that's maybe not quite the way to do it. And I've appreciated that over the years. So absolutely on behalf of the IGB members, colleagues past and present, we really want to sincerely thank you. And I add my personal thanks to that. Oh, I'm not finished. I've got more to say. So it's a few weeks before you finish, so you're not running out the building yet, but genuinely have a very healthy, happy, long retirement on behalf of all of us. Thank you. Oh, other people, there's flirts. Jacqueline and Jennifer, I think, would come in. Oh, and Ian. Oh, right. Jacqueline, Jennifer, then Ian.
First of all, just to say, thanks very much, Elaine, for all your support. You've supported in the IGB since 2017, so nearly 10 years. So a life sentence. But yeah, and I know Carol McDonald's also retiring, but she's not calling it retirement. She's calling it next chapter. So good luck with your next chapter, and no doubt we'll bump into you around Paisley. I'm sure we'll see you. Don't be a stranger. The other thing, and I'm sorry I didn't warn you in advance of this, Mags, was I just wanted to pay tribute to one of our former colleagues in the NHS non-exec, Morag Brown. Morag sadly passed away just a month or so ago. I didn't feel appropriate to talk about it at the beginning of the meeting, but I just wanted to say it was the decisions that we've made today. It's been very, very difficult, but Morag was somebody that I always looked up to and somebody who always thought, what would Morag do? And I knew I was going to get emotional the minute I started speaking, but we were all very fond of her, and she'll be very much missed. Thanks.
Thank you, Jacqueline, for that. Really appreciate it. Thank you.
I was actually going to say the same. Elaine, I didn't know you were leaving, so that's news to me, and I can't thank you enough for your support, especially through the first 5 years, because you were instrumental in getting me through a lot of the meetings. But I was also going to say about Morag, you know, because she was an NHS board director when I got elected in 2017, and she was instrumental in how she taught us to not only read the IGB, but in how to deal with it, you know. So she really was. She was a really strong character, and she'll be missed, as will you, Elaine. But you know, you're going to more positive destinations.
No, I just wanted to say to Elaine, we'll miss you. I'm not entirely sure if I'll see you again, because we've got the full council on Monday, and then it's basically it's recess. It's an early recess because of the FITBA. So we're all kind of leaving a bit earlier. But listen, you've been a fantastic help to me over the years. Fantastic help to my colleagues in the Labour group. I've known Elaine for 30 years. So when I first met her, she was in her late 40s. But listen, she has been tremendous. And there are so many unsung heroes in this council and health and social care partnership who don't, you know, look for the limelight. They don't get the limelight. They just quietly got on with their job professionally. And I don't know how many committees you've been involved in over the years, but loads and loads and loads. But I think the word you said there, Mags, was consistent, and you've always been the same. And I think the thing that gets you through, and the thing that gets most of us through, because of some of the crap we have to deal with in here, is your sense of humour. You're always the same. You're always laid back, and you're always ready to have a chat about whatever. Your choice of a man is not very good, right enough. But other than that, it's been great knowing you and been great working with you, Elaine.
At this point, I will remind it is still being recorded, and Elaine, you are welcome to join future meetings online. We do know that. I'll bring Lisa Marie wants to come in.
Thank you, Mags. And I might have to do this publicly at full council if Elaine's there as well, because I chaired my board yesterday at which Elaine supports me, and she didn't tell me that that was the last board before we left, so I'm going to embarrass you now, Elaine. So I, like a couple of the other councillors here, have now known Elaine for 9 years. She's had the dubious pleasure of being the clerk on all of the boards where I've got a significant degree of responsibilities, whether that's the audit committee here, my One Ren board, various other ones. Elaine and I, there are weeks where we spend every day together, and she is absolutely brilliant and has been an absolute stalwart and seen me through all of it, to the point where I've been sitting in meetings 5 years after a decision, and Elaine will say, this is what we decided in 2017, Councillor Hughes, which is very helpful when you're trying to remember something. There is nothing Elaine does not know and nothing she can't fix when it comes to how our local authority and partners have worked. And you will be sorely missed, Elaine, and you're also just very good fun. So we'll miss you, but I'm also delighted for you because I know you want to retire, and I'm happy that you get to go and do that.
So happy retirement. So thank you all very much. I probably just, my final thanks actually is to everyone who's contributed today in terms of questions, input. Thank you for all being respectful and allowing that conversation to flow. Thank you very much to all the management. Not everyone spoke and presented today, but I think we all know the amount of work that's gone on in the background in answering our questions and preparation for today. So that's not underestimated, and really grateful for that. So with that, I'll close the meeting. Thank you all very much. Thank you.